I had seen him back in around 2000, 2001. There's a statute of limitations that states you can't do anything about it, so to speak, for 2.5 years. And I now found out that the state had been investigating him for close to 4 to 5 years.
And about what?
About evidently him using a multi-dose syringe, doses of, what the heck do they call it, medicine.
Yes.
And that he was using syringes more than once. He was changing the needle, but he was using these syringes more than once. If they knew this, why didn't they notify me 3, 4 years ago and make me aware of this, instead of me waiting 5 years, going to my doctor, getting tested, and finding out that I have hepatitis C?
And that's an excellent point, and that's your second excellent point. Do you believe that if the public was better informed, that there may be a reduction in medical errors?
I would think so. I mean, it makes perfect sense to me that it should be, you know, that there should be some type of, somebody looking over this to find out what the heck is going on.
Yes, and I agree. And the letter, I believe, informed you that you may have been placed at risk for a medical condition. What medical condition was that?
Hepatitis C, which is a life-threatening disease. It's really changed my life quite a bit. You know, finding out that I have it, I have to, you know, it's very contagious from what I understand. So, you know, it's changed my life and my family around me, you know, as far as my drinking habits, you know, even liquids, whatever. I make sure that nobody drinks out of the same glass that I do. If I take a glass, I make sure I put it right into the dishwasher, that nobody should accidentally pick it up.
Right. Let's get back for a moment to the day you received the letter.
Oh, that
You
was
receive an
terrible.
envelope, you don't know what the envelope is, you open the envelope, you read the letter. Tell us what you were feeling at that moment that you were reading the letter.
It was kind of devastating, you know, considering everything that I've been through in the past, and now finding out that there's a possibility of me of having hepatitis C on top of all my other ailments that I've had. It shook me up quite a bit.
Yeah, I can imagine.
It shook me up quite a bit.
Shocking. And how long ago was that you received that letter?
December 14th of 2007.
Just about 3 months ago.
Correct.
And your life has changed dramatically since then. Not only your life,
Of
but I
course.
imagine your loved ones' lives.
Absolutely, my family all around me. You know, they're worried for me. They're worried about it being contagious. You know, I mean, I have grandchildren. You know, I have children.
Yes.
I have a wife.
Stephen, let me ask you: do you think the people around you are afraid to touch you?
It's a ticklish question to kind of answer. I hope
Well,
not.
Stephen, if they are, I want to make a point here that there's no harm in touching someone.
Thank you. You see that?
No
Family?
harm in touching someone who has hepatitis.
That's great to
It's
know.
primarily the concern with body fluids.
Right.
Also, there's a concern as to what stage the hepatitis is in. And you certainly have to get continuous medical care.
I go every month. I have my blood checked.
Yes.
You know,
I suggest that
watch
you
my diet.
regularly get that medical care, that you follow the instructions of those medical doctors. And Stephen, you're right now leaving it up to the medical doctors to prolong your life as much as possible.
Fortunately, I have a very good primary care physician.
Good.
If I can mention his name, Dr. Scavron.
Sure, please, go ahead.
And he's a very caring doctor. I go into his office just to check my blood, and he sits and talks to me for 40 minutes, 45 minutes. I mean, you don't find many people like that today. Or maybe you do. Maybe, I don't know if I'm just one of the lucky ones, but he's the greatest.
Yes, and
You know?
I agree with
And his
you.
whole staff.
Yes.
Everybody that works for him.
Now, I do want to go back to something that you had mentioned earlier, that you were concerned that the Department of Health had not informed you in a timely fashion.
Yes.
Now, I believe there is legislation that's active at this moment in New York State, which doesn't allow you the means to be properly compensated for what you feel may have been a wrong.
Correct.
Do you know a little bit about that? Tell us about
Well,
that.
from what I understand, there's a 2.5-year statute of limitations, you know, like I said, and New York State knew about this for years because they had been investigating him for years.
Yes. Now, tell us what your understanding is of that statute of limitations. The 2.5-year timeline, what does that refer to?
2.5 years from the time that you were treated,
Yes.
instead of the time that you were notified.
Yes, and what do you think it should be?
The time you were notified.
And I agree with you, Stephen. I think that if a patient undergoes a medical procedure or is undergoing medical care and has no knowledge that that medical care
Correct.
is substandard and then becomes informed at a future time that it harmed them in some way,
It's almost like the state's working for the doctors.
there must be some way to properly compensate the patients. Now, I'd like to know the compensation that you feel you deserve. Is it a punishment? Are you looking to punish someone?
No, not really. I don't think what Dr. Finkelstein did was intentional.
Okay.
Okay? I think...
You don't think he was trying to harm you?
Oh, no.
No. He was trying to help you.
No question.
And he did help you?
Yes, he did.
Yes.
You know, but I think he took maybe the wrong steps. I don't think if he was totally, how can I put this, you know, up to date in what certain procedures are to do.
Right.
And
I think the problem at that point
he should
was...
be disciplined. You know, I don't think he should be hung. You know, just think that that in some way he should be disciplined.
And that, Stephen, that discipline, how is that going to help you or other patients?
By doing things correctly.
Yes, I agree. And I believe that's the third issue now, the third solution that we have to correcting medical errors. I think, at least listening to you, I think what you're trying to say is that disciplining a physician or compensating a patient may deter other healthcare providers from conducting themselves in an improper way.
I think you put it very eloquently.
Yes. And I think it's fair that a patient be given the opportunity to seek out those remedies from the time they become informed of the problem. Would you agree with that?
No, absolutely, yes.
Yes. Now, Stephen, there are other issues going on in the healthcare industry nowadays, primarily the insurance companies, the HMOs, the companies that reimburse the doctors and the hospitals. What are your thoughts on the insurance companies?
This may sound a little crazy, but I feel that anybody that has insurance, the doctor should get paid exactly what they're entitled to. Unfortunately, it works the exact opposite. Somebody who doesn't have insurance, they're the ones that have to suffer and pay the full amount to the doctors. Where a patient who has insurance, doctor might only see 10% or 15%. I mean, I have no idea what they get, but I know they don't get paid in full what they're really entitled to.
Right.
And I don't understand that way of thinking.
Yes. Well, Stephen, you're absolutely right that the insurance companies limit what a doctor or what a hospital is going to be reimbursed. And the doctors and the hospitals are not permitted to increase their fees when their bills are increased. Their rental bills, their supply bills, their medical malpractice bills are all being increased, but the fees that they charge, their reimbursement fees, are not increased.
This is why they're so short of people and so short of doctors and so short of nurses, and why the average patient can't get the right care.
Yes, Stephen, I think you hit the nail right on the head. I think that doctors and nurses and hospitals are being placed in a